Yeah. Hi, good afternoon. I'm Dr. Priyah from My Dental Care, Sri Kamangan in Puchong branch. Today, my Facebook Live topic is just going to be a continuation of my previous topic, which is regarding crown. So, crown for a tooth. So, basically, what is it? It's just a refreshment. I can show the slide. So basically, crown is actually a helmet or a extra protection for the tooth that is not healthy, or it doesn't have a complete tooth surface, the pata, atau there's some discoloration, atau there's caries, ada cavity, and terlalu extensive. So tampalan is not enough and it needs a further treatment, and also after root canal treatment, the tooth needs extra protections like a helmet. So basically, crown is actually a helmet for a tooth. So I'm going to talk about the types of crown that we have. One is, you can show the picture, the second slide. Yeah, one is zirconia and another one is called PFM. So basically, next slide. Next slide. So zirconia is basically completely a tooth-colored crown that doesn't have any metal in it. It's fully opaque. It's white in color. The shades can be chosen according to the patient's tooth color. So it looks very much natural because dia tak ada metal or any other color content inside surface. So it beautifully shows up as a natural tooth under the light. And for the tooth reduction, so we have to actually make the size of the tooth a little smaller so that we can actually place a helmet on the tooth, right, like a crown. So the tooth reduction that is needed for zirconia is around 1.5 mm only. So minimal tooth reduction is needed. Most of the tooth surface, crown of the tooth is preserved. And the next slide. This is PFM crown. PFM crown is basically a metal inside and then a ceramic layer on top. So it will be also in tooth color. The color can be chosen according to patient's preference. But inside it will be metal. So definitely if it's a metal, it needs a thicker layer to be covered on the tooth. So more tooth surface needs to be removed. So basically for PFM crowns, around 2 to 2.5 mm of tooth structure have to be reduced. So both are equally good, both are strong, both long lasting. It's just the tooth surface that need to be reduced varies because of the content of the crown. So today I'm going to talk about zirconia crown first. So if it's only involving one tooth, it's called crown. But if it's involving more than one tooth, it's called a bridge. It's called like a jambatan. Next slide. So this is a bridge. This is a zirconia bridge. The one that is just a single unit, it's called a crown, which has more than one unit attached together, it's called a bridge. So this is a zirconia bridge. The inside, it's full of opaque color, so it will be beautifully shown up on patient's mouth. It won't look heavy or thick. And zirconia will actually is like little bit lightweight compared to the PFM crowns. So I will show you some samples that I've done on patients in my dental care so that you will have a better understanding why a patient needs crown. So this is one of my case where the patient came complaining that she did filling previously many times on that broken part of the tooth, which is in the first picture. And then, she was trying to eat something and her whole crown, her whole kapala of the tooth has fractured, and she came to the clinic thinking that she needs to cabut, she needs to extract the tooth, and she was wondering what to do after that. And until the the tooth looks discolored because previously she did root canal treatment, but she did not place any crown for it. So of course, if root canal treatment Rawatan Akar has been done on the tooth, the color of the tooth will start changing. That's why always the dentist will advise for a crown placement, not only for a protection, also to cover up the discoloration of the tooth. And she thought that she has to extract the tooth, but actually, if your crown or the kepala of the tooth is broken, not necessarily you need to cabut the gigi. First, the dentist will actually take an X-ray and say if your akar, bahagian akar, the root of the tooth is still strong, there's no any infection, there's no mobility, you can actually save the tooth. So what I suggested for the patient is to do rawatan akar, means to and to cover the after doing rawatan akar, you need to actually add an additional support, something called fiber post. Like you see in the picture 3, there's like some kind a transparent stick which is sticking out from the tooth. So we will actually drill the tooth after doing rawatan akar, root canal a little, and then we place this additional support on the tooth. And once placing the additional support on the tooth, it's like basically when you're building something, you need to make a strong base, right? So we are actually giving you a strong support which is attached to the root of the tooth. And then in the picture 4, once the fiber post is placed, you will actually top up the crown surface with the tooth filling material, make it as a tooth surface, and then we will prepare it so that accordingly, we will prepare the tooth accordingly for the placement of the crown. So once we make the tooth preparation, we'll actually take an impression, we akan ambil acuan, and then we'll send it to the lab. Once we send it to the lab, and then the lab will fabricate what is needed for the patient if the patient requires zirconia or PFM. So this patient, she chose a zirconia crown, and I suggested her for a zirconia crown because it's a front tooth. So when it's front tooth, it's basically not just for speech, it's also for aesthetic purpose, for kecantikan. So when you need PFM is also good, but zirconia will be more aesthetically pleasing because of the opacity. So she chose for a zirconia crown, and she also placed crown for the RCT treated tooth, which is discoloring. And the picture, can I have the slide picture, please? Can I have the slide picture? Yeah. So in the previous picture, sorry. The previous picture, please. Yes. So in the picture, you see that the number 5. So the crown has been prepared, and then we take the impression, send it to the lab. And the next picture is when your crown has been fixed. So she did crown for her broken tooth and also for the front tooth which has discolored, and it became really beautiful. Like it looks 100% natural. Like nobody actually will know that you are wearing an artificial tooth, you know. And then the next slide, please. This is another patient. He the first picture is actually he went to a different clinic previously, and they tried to do something, and it didn't really turn out good. And he started having infection on his tooth, and he came with all his tooth mobile, and the crown or the filling that they did was all shaking on it. So what I suggested for the patient is to remove whatever done on the tooth, and on the X-ray it showed that he has infection covering up to the root surface. So had to remove one of his tooth because of this extensive infection, and the remaining teeth that we did, I did root canal treatment, and then the size of the tooth was reduced for the placement of the crown. And he also chose zirconia crown, and the third picture actually shows the zirconia crown placement, and he wanted the zirconia crown to match exactly to his tooth color because he's a heavy coffee drinker, so he has a lot of stain. So he said that he doesn't want it to be too white. So Zirconia crown doesn't mean that it will come only in white color. You can actually change the tooth crown color according to your preference. So the previous patient, she wanted it to be very white, and this patient, he wanted some stains so that it looks natural, that it blends well with this other stain to that has coffee stains in it. So these are the sample of zirconia bridges for today. Maybe on my next slide, I will show you samples for the PFM bridges and crown. So you'll have a better understanding. If you think that you fall into one of these patient categories that you need to correct your teeth shape, your broken tooth, or you want to change your teeth color, you can always get a bridge or a crown done. Thank you.
Hai semua, jangan lupa like FB My Dental Care, follow Instagram My Dental Care dan juga subscribe YouTube channel My Dental Care. Captain Gigi to the rescue.